Hello, everyone. You made it to your final week. Welcome to week 8. Uh, this week we talk about a few different things. One being an understanding of level of care needs. And so it's really talking about the environment that someone can begin recovery in when you're looking at addiction and co-occurring disorders. And so the guide that we follow is called ASAM, and it is an American model of medical model, and so it's written by physicians, and this is a complex model. However, it's one that most agencies will use, that particularly physicians will use, insurance companies will use, because it's a way to break down a least restrictive level of care for clients. And the difference is, does someone need a medical intervention in a setting such as a residential, like detox setting, where they need to be monitored because stopping the use of a substance may be a life-threatening risk. And then you have physicians and nurses who are able to monitor different vital signs, provide medication to help through that process. And so level of care would be anything from medical intervention to needing a in-house structured environment or outpatient. And so ASAM is that tool. It's difficult at times because it is a medical language, and counselors aren't always as familiar with that medical language. So I encourage you to take a look at the crosswalk resource that's provided, because it does break it down into more user-friendly terminology. But I want to encourage you that even though you're going to be introduced and kind of take a shot at understanding a client in the perspective of the ASAM language, that it takes a lot of time and practice to really begin to refine the assessment in terms of where they fit in this in these scales. Usually when I'm working with someone in a supervision session, often it takes about 6 months or more of regularly using this tool in case conceptualizing a client and their symptoms to what their needs are. So try not to get discouraged if you find some frustration with this, because it can be a little difficult. So for this course, it's really an introduction and understanding the reasoning behind it and understanding some of the language. It has 6 dimensions that we look at. The first is understanding the potential for withdrawal, or if someone is immediately intoxicated. And so we want to look at really that potential. Is it life-threatening? Because a physician or an inpatient facility, a detox, is going to want to look at that and say, we need to know there's enough risk to justify these medical interventions. And so there's more when we're looking at severity, is that we're looking at some life-threatening potential of symptoms if someone's stopping the use of a certain substance. Particularly those are going to be like your barbiturates, those medications usually for anxiety, like Xanax and a few others that hopefully you looked at in the chart that we referenced earlier in the course, as well as alcohol, and even combining the two of those. Those are really concerning because of the withdrawal effects of those can be the inability to breathe and some other effects that are life-threatening. So that's really that first dimension that we look at. Secondly, we look at medical complications. And really the main focus of this one from a medical professional is looking particularly at the opioid use, that someone has been prescribed a medication because of pain or because of a legitimate issue, and what's going to complicate recovery is if this individual is now seeking recovery for an addiction to an opioid. Well, how do we make sure that we manage pain as they're coming off of the medication and those substances at the same time? And so Dimension 2 mostly focuses on opioid use disorders and the complications of those other medical disorders they're dealing with, and how do we make sure that that's being treated at the same time to not set someone up for failure or more complications in the future. Dimension 3 is looking at more emotional and behavioral concerns, and this is where we really do assess for those co-occurring disorders. Is someone dealing with some emotional symptoms or some other symptoms that are really going to interfere with the process of recovery? And that doesn't always mean that someone has complex trauma and, well, they're automatically in a severe category. If someone even has the symptoms of PTSD, yeah, they're taking medication, the medication's working, they're working with a psychiatrist, they're doing, really managing those symptoms quite well, then that's going to be less of a concern because they're fairly stable in that area, even if we begin working on treating the addiction disorder. And so you'll see how that chart kind of breaks those things down. These first 3 dimensions really are when we're looking at more of the potential of needing a more stable environment, such as an inpatient or even a detox environment, because we're looking more at medical and significant emotional disorders that might need medical intervention. And so those are the levels that we would look at, either a detox or inpatient setting, if there's some severity there. Those most often are those 3 where we're looking more outside of an outpatient setting, the higher that gets. So, but from there, then we take a look at a dimension of readiness. And we talked a little bit about stages of change. And so we really do understand how ready is this person to change. As we move towards a more severe end, we're really looking at more pre-contemplation, but that's in the context of the severity of the disorder. If someone really has a mild disorder, or it's not specified at this point in time, and says, I was really at the wrong place at the wrong time, they might not really be resistant to treatment, yet really not have a significant problem, and stopping for them is no problem. And so we wouldn't say severe that they're not ready to make change, or they're resistant because they're saying they don't need to make change. We really have to look at it in the context of the severity of their disorder. If someone does have a severe disorder, and their language is telling you, they don't want to make any changes, they don't see any connection at this time, they're just not going to follow through, then it would be more concerning, right? Because the space that they're in, it's going to be really hard for them to begin the interventions that they need to make some changes to promote health for their life. So again, you'll see how that's broken down a little bit more. The next dimension is relapse potential. And that's really looking at, typically this is more where we're looking at someone who has developed that disease, that they've had a recurrence of symptoms several times in their life, that or maybe they have a more moderate to severe disorder and they really have no coping skills to make a change. So they've identified that substance use is the way they cope with stress and pretty much everything, and they're currently still in a very stressful environment. So we're looking at, do they have the tools necessary to make the change to stop using the substance? Are they able to use those tools? Have they demonstrated the effective use of those tools in the past? So that's one thing we want to look at. And this may be another dimension where we may recommend inpatient treatment if this is a severe dimension, that someone has a very serious disorder and they're very likely to continue their use pattern. They're having a really hard time stopping, coping skills aren't working, and maybe they don't have some of the other medical issues. So this might be a dimension we would look at and justify inpatient if that was the case. The last one is recovery environment. And so we want to look at who's around the client. Do they have healthy family members, people that are supportive of them? Are they in a school setting where they have support and people checking on them? Do they have a strong community support group that they're a part of? So how likely is it that in the environment they're in, that they'll be able to have a healthy recovery process? And so that's the dimension that we look at here. Mild being they're really none to mild really being they're very supported, and this really isn't much of a concern. It's a positive factor, versus severe maybe this individual is living in a home where everyone around the individual is continuing to use or engage in high-risk behaviors. So that's something we'll look at. So that's just a very basic introduction to ASAM. If you do end up using this tool in the future, this is where supervision is very helpful to continue processing cases and really take a look at this, because it helps you know what's the least restrictive environment for a patient to heal. And if they need an inpatient or a medical level intervention, this will help with that. You have your major assignment due this week, and so there's several components to that. One is the PowerPoint, which everything you've learned through the course, you're able to share with the client from a perspective of how would you do that in a language they would understand, in a way that helps them understand that information. So those slides, the slides of the PowerPoint will be the language that you're using with the clients. The notes section will be how you want to present it, your instructor, of understanding more the academic language of that. So that's kind of your opportunity to practice both and get feedback on that. There's also a worksheet. It's a recovery management plan, something you can use with clients or some form of that, to walk through with them from beginning to end of some things to keep in mind and help support their recovery process. So you'll be uploading both of these into the assignment area. You do have the option to record it and get feedback on those presentation skills if you want. If that's a choice you're going to make sure that you alert your professor to that, so they can be prepared that that's a format that you want to get feedback on. You won't be graded on a type of presentation. You're only graded on the development of the PowerPoint and the worksheet. So I hope you have enjoyed this course and the lectures. There's a lot of information, there's a lot of resources, so I encourage you to continue to learn more about this population, however you may use it in your current field.